Hi, today in this video I want to talk a little bit about something called estrogen dominance. And you've probably heard that term. It's just this idea that you have a hormone imbalance that is functionally creating too much estrogen. And I have seen that come from actually having too much estrogen or having too little of progesterone, which is kind of this balancing hormone between estrogen and progesterone. You want those two to be equal. So all this to say that what is termed estrogen dominance can also be a relatively low level of progesterone. So I see those things commonly in practice. I do a lot of hormone work with clients and run something called a Dutch test or a salivary hormone panel, depending on what the client's needs are, to help them figure out what's going on with their hormones. So let's talk a little bit about what it feels like to be in that state of estrogen dominance. So from a perspective of how it feels to someone who has this issue, I see a lot of women, they're struggling with very heavy menstrual bleeding. They're bleeding more than the normal 5 or 6 days of a cycle. Maybe it's 10 days, and it is so heavy that it's debilitating. They are so drained, they're so tired, they can't function. Cramping, pain, those kinds of things, just being out of commission when your time of the month hits. That's not a normal phenomenon, but unfortunately a lot of people are living with that. So if that is you or someone you know, please realize that that's not normal, and I'm doing this video so that you'll think, okay, that's something that I probably need to look into and possibly get some help with. So that's what it feels like. Some of the things that people get diagnosed with when they're estrogen dominant are things like endometriosis. That's probably the most common one. Polycystic ovarian syndrome, although that's a little different, that can be an excess estrogen situation as well. That's usually has a few more pieces to it. And I've done some videos and written some articles on that specifically. So if you've been diagnosed with that, or you've heard that term and you want more information, you can look up one of those videos or read the blog or visit the podcast for that. But anyway, that's related, but maybe a little bit different. And so the first thing that I do when I work with ladies like that is I ask some questions, and then we try to connect with looking at the hormones to see exactly what the problem is. Is their estrogen too high? Is it just unbalanced by the right amounts of progesterone? What types of estrogen are high? There's 3 types. A lot of people just focus on the one form of estrogen, which is E2. It's the most common one that you hear about. But anyway, looking at all of that and trying to figure out what we can do to balance it. So what are some natural things we do if we're going to try to solve that issue? I think the first question is asking why did that happen? Why are those hormones unbalanced, and how do we get them back to the right balance? Unfortunately, the medical solution to a lot of these hormone problems is just saying, oh, here's a birth control pill. Especially women under 40 tend to get that solution. Here, we'll just put you on the birth control pill, and what that does is takes away your normal natural cycle and gives you this like fake cycle, really, that not only is it not addressing the problem, it can actually, you're taking a synthetic form of estrogen. So if you're already in a situation where your body is prone to having too much estrogen, I think the last thing you want to do is go adding more estrogen to the mix. So there's that. And then if you're over 40, a lot of times the answer is hormone replacement therapy, which again, there's some really significant increased risk of developing breast cancer when you use hormone replacement therapy. And I just don't think that is solving the underlying issue. So I think if you really want to address the problem, you do some analysis and figure out, you look at a Dutch or a salivary hormone panel and really look at what the hormones are doing. And you look at it that way because if you do it with blood, all of your sex hormones are bound to the proteins in the blood. So what you're seeing is a level of hormone that is not usable. So when you use urine or saliva, you get the free hormone levels, and that paints a better picture of what is actually available to be utilized. So I think that's a superior way to do it, and that's the functional way to look at hormones. But what if you suspect this is an issue for you and you want to start doing some natural things right now? I would say the biggest thing for this is to look at the beauty care products you use and get rid of endocrine disruptors, which is a fancy way to say things that screw up your hormones. And the biggest one for women is parabens. They go by the name methyl paraben, propylparaben. There's a whole bunch of words that end in paraben, and you see these in mostly makeup, lotions, beauty care products, things like that. And what they do is they have been shown to disrupt natural hormone levels. The FDA in the United States actually says that they're safe, but if you look at European countries and Southeast Asian countries, most countries in those parts of the world have banned these paraben products because of they can't determine that they're safe to be used. So they have just eliminated them from public consumption, which I think is wise to do. You can use the EWG as a resource. It's the Environmental Working Group. If you go to ewg.org, they have a database where they look at toxins and cosmetics and things like that, and they give beauty care products a rating. So you can test the products that you're using and see how clean they are. The other thing the second thing you can do is eliminate plastics from your food and drink life. And that means don't microwave things in plastic. Don't drink out of plastic water bottles. Things like that, because the plastics in there break down and they form, again, they're not parabens, but they're different. You've heard of BPA and different chemicals like that break down. And those disrupt your hormones as well, and they can mimic estrogens. They're what's called a xenoestrogen. It's like something that mimics the properties of estrogen in the female body. So just little things like that. They seem really little, but they're super powerful in the world of reducing these things that mess up your hormones. And then just eating a clean diet, that cannot be overstated enough. That is the foundation of all good health. Drinking enough pure, clean water, all of those things that really help. And then what I do is when I run hormone panels with someone, instead of using hormonal prescription medicines to balance hormones, I use things like herbs. There's some that will help bind estrogen naturally. There's some that will help your body increase its own production of progesterone, and looking at all the downstream markers for these hormones, making sure you have enough of the building blocks to create these, that you're not, if say for example you're creating a lot of cortisol because you're under stress, that cortisol will be diverted to the production for stress hormones, and you will not make enough progesterone. That's a fairly common, women that are under stress, all of their resources are going to the production of cortisol, and the pregnenolone does not convert to progesterone. There's a pathway. It's a phenomenon called the pregnenolone steal. But anyway, so looking at all those kinds of things, and then coming in with the right herbs that either can bind estrogen or increase your natural production of progesterone, or going upstream and looking at the root cause of why those things are out of balance in the first place. So anyway, I hope that you found that helpful, and there's a few tips in there that you can use and try right now. And if you have any questions, you can reach out to myself or my team, and we will guide you on your journey to take the next step in figuring this out. Okay, thanks for watching.